So let's continue with our talk here about the contemporary strategies for dental hypersensitivity management. We would like to start with the diagnosis, which is very important in any disease management. And in fact, the diagnosis of dental hypersensitivity is based mainly in three aspects. The first one is the dialogue-based interview or the anamnesis. The second part is the physical examination, and the third part we have to make the differential diagnosis in order to have the certainty that this is really dental hypersensitivity. So diagnosis is starting really with the dialogue-based interview, which we have to know if dental hypersensitivity is a chief complaint of this individual. So this means that the individual refers to hypersensitivity as the first problem that he is in the dentist for. So this demonstrates the complexity or the importance that he or she gives to dental hypersensitivity. Also, we have to see if this is a secondary complaint, when, after informing the presence of gingival recession or experienced periodontal therapy, the professional asks and the patient refers to have tooth hypersensitivity. So this means the impact for this patient is a little bit less. So in fact, in this dialogue-based interview, we have to ask for the complaints. When does it hurt? How does it hurt? Where does it hurt, to see if it's localized or generalized? What are the oral hygiene habits of this individual? What are the toothbrushing methods? What's the stiffness of the bristles? Especially about acids. We have talked in the former part of this presentation that acids have a very important role in being a predisposing factor for dental hypersensitivity. And in the end, we will quantificate the pain with some scales. But coming back to the acid things, we have to make a food inventory. There are several ways of asking about specific questions related to acids. For example, exposure to fruits, to wines, to vinegars, to soft drinks, to whatever we come in mind, taking in consideration what the patient is telling us. But the more effective ways are the inventories. Either a 24-hour inventory in which we ask for the patient to tell us, yesterday, from the moment you got out of the bed, when you woke up until you went back to bed for sleeping, what did you eat and drink the whole day? Or in a different approach, which is also very effective, to hand out to him a food inventory in which he will take note of everything he eats during 3 days. So after having this in mind, we can go for a physical examination, which is an important part of diagnosis. And in the physical examination, we have to do the same kinds of examinations that we make for different other situations. The oral mucosa examination is similar to the routine examination. However, we have to give special attention to scars, ulcers, or gingival erosion. As we see in this patient here, we're going to see a scar, which means he's using the toothbrush with excessive force or with bristles which are harder than they should be for him. Also, continuing the examination, we're going to make periodontal examination to see if the individual has periodontal disease. Because if he has periodontal disease, he has inflammation. And individuals which are with inflammation, and this is a systemic inflammation, they have a lower level of limits for having pain. So the limits for having pain are lowered by the presence of gingival inflammation. We have also to take a look at the teeth to see the presence of recessions, to see eventual erosions of the teeth. We have to see the presence of dental caries and dental caries activity, and also to suspect about the possibility that this individual would have a pulp pathology, either reversible or irreversible pulpitis, which is an important part of the differential diagnosis. We have to do differential diagnosis because we cannot treat a patient with a cavity, with a tooth cavity related to tooth decay, by the use of an anti-hypersensitivity dentifrice, because he's not having hypersensitivity, he has a very profound, a very deep caries lesion. And also we have to take a look at the different possibilities of differential diagnosis. For example, besides caries, maladapted restorations with inadequate techniques, alterations of the enamel surface, other possibilities of pulp pathologies, and also pain or hypersensitivity after bleaching. So this needs to be in our mind for us to make the real diagnosis of the pain of this individual. And the diagnosis of the pain needs to be performed quantitatively. So we have to use variable stimuli. For example, we have to use air blast. We can use tactile stimulus. And after this, the diagnosis has to be completed with the quantification. And we use normally a visual analog scale, which in the left part of it there's written no pain, and in the extreme right part of it there's written the worst pain possible. And then the individual will, after the stimulus, grade his pain or her pain. And the meaning of this is that we can have a possibility of knowing if the sensitivity is mild, is moderate, or is severe. And after this, when we go in other moments of the treatment, we're going to see if this line is going stable or is going to the right or to the left. If it's going to the left, means we are having a good results. Another form of quantifying pain is the use of the verbal rating scale, which means after the stimulus, the patients will rate his or her pain, giving a grade, for example, from 0 to 10. And we're going to, after a while, after the application of some kind of treatment, we will do a quantification of pain again, without the patient having the records of the previous sessions. And this means we are going to have an idea of the magnitude of the effect of the therapy to be determined. And we also have to really make a differential diagnosis between pulp pathology and dentin hypersensitivity. So actually, the pulp pathology, we're going to have a long-lasting pain, and in dentin hypersensitivity, you're going to have a short-lasting pain. This pulp pathology, we're going to have the persisting of the pain after the cessation of the stimulus, and in dentin hypersensitivity, after the cessation of the stimulus, the pain is not persistent anymore. And you are going to have possibilities of having associations with periapical reflections of the pulp pathology in radiographic examinations, and thus you will not have in dentin hypersensitivity. So making the differential diagnosis is the moment in which you say, well, you, Mr., you, Mrs., you have dentin hypersensitivity. And with dentin hypersensitivity, the degree that you have is mild, is moderate, is severe, and plus you're going to have this or that kind of treatment. And after knowing this possibility of that the patient really has true dentin hypersensitivity, that we're going to plan what is going to be our therapeutic approach. But before we go for the therapeutic approach, I would welcome some questions from you relating to the parts that we have had up to now.
Now let's check the next question from Terview GTC.
My name is Agnieszka Kocińska from Terview GTC in Europe, and I wanted to ask a question if arginine technology is good for preventing hypersensitivity, or it can be used only when someone already has it.
Thank you very much, Agnieszka, for this very nice question. In fact, the arginine technology was designed for treatment. It is a plug that we are going to put into the tooth surface that will limit the movement of the fluids. So actually for prevention, it is not what it was meant for. What we have to do for preventing dentin hypersensitivity is first, prevention of gingival recession. And prevention of gingival recession is made with good plaque control, not excessive, not limited plaque control. And this is the best way for preventing dentin hypersensitivity. If you have recession, what do you have to do? You have to prevent also with a rational use of acidic drinks and foods. So this is the best prevention. But on the other hand, if you do have gingival recession and you do not have dentin hypersensitivity, there is no problem of using the ProArgin technology. By the way, there's no problem of using the ProArgin technology in any individual in the sense that the other components that are part of the dentifrice are also working in this situation. So, but it was not meant really for preventing dentin hypersensitivity. It is the very best way of treating it, and this is for sure. Thank you very much.
Thanks, Cassiano. Enjoy the next and last block. Stay with us.